Hello, my name is Paige Byrns. I use she, her pronouns, and I'm a second year doctoral student at Wright State University's School of Professional Psychology. Today, I'll be talking about points of connection and conflict, parent-adolescent relationship dynamics in multi-generational ADHD families. My faculty advisor on this project has been Dr. Sarah Bielek, and if you follow the QR code on the screen, it will take you to my poster. ADHD has significant hereditary properties. 43% of adults with ADHD who have kids will have kids who they themselves have ADHD. We also know that a positive relationship between an adolescent and their adult caregiver can serve as a protective factor for both parties. In children, it can protect against mental health disorders, suicide, and alcohol misuse. In adult caregivers, it can protect against parental burnout, social isolation, and child maltreatment. These are some of the factors that I utilized when completing my literature review. So looking at these databases within these years and using these keywords. One of the major themes that emerged from the review was this idea that parents with ADHD face distinct difficulties with parenting skills. We know that parents with ADHD struggle with consistent routines and implementation of reinforcers, as well as supervision. They also struggle with harsher punishments, overreactivity when disciplining their children, and overall less warmth with their children. Some of the factors that can influence this include the parent's ADHD symptoms, so whether they are displaying inattentive versus impulsive hyperactive symptoms, as well as the intensity of those symptoms, and the presence of an additional caregiver in the home and the gender of the parent with ADHD. Another major trend that emerged from the literature was this parallel idea that adolescents with ADHD face distinct difficulties with developmental domains. Adolescents with ADHD are at higher risk of developing conduct-related disorders, struggling in school, and getting into risk-taking behaviors at a greater rate than their same-aged peers. They also display increased conflict with parents and are more likely to experience authoritarian parenting and believe that they are not supported by their family. The good news is the similarity of fit hypothesis demonstrates that positive parenting skills such as warmth and empathy and autonomy, respect for child autonomy, is actually higher when both the parent and the youth have ADHD, as opposed to a parent not having ADHD or having low-level ADHD and a youth with ADHD. So how is this applied to treatment? We know that ADHD symptoms in adolescents are typically treated through a combination of meds and behavioral interventions that require some type of parental involvement. Family-based treatment, however, with a greater level of parental involvement can treat core symptoms of ADHD in adolescents, as well as hit on some of those family conflict pieces and parenting skill issues. We know that conflict is often caused by ODD symptoms and planning difficulties with the child, so that can be targeted in treatment. And some limitations in the current research are a lack of strength-based exploration in this unique relationship, and the fact that the similarity of fit studies have mostly been conducted on younger children as opposed to adolescents. And here are my references.